Welcome to the Sustainable Clinical Medicine Podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Before we get started, I just wanted to remind those of you who are working on backlogs, just check in the www.chartingcoach.ca/backlog-buddies is a place you can come and do your backlog alongside fellow clinicians and physicians. So if you want to kind of hang out and have some ability to stay on task for the 2-hour sessions, come along. We'd love to see you there. Hello, you guys. Now, this week, I was asked to do a talk on coping with uncertainty in family practice for the Edmonton Primary Care Network family doctors. And I crowdsourced the areas where you see uncertainty within your clinical day to the Canadian Women in Medicine Facebook group. And I am so thankful to those amazing humans for giving me some of the ideas of where you experience uncertainty in your practice. And so I promised that I would jump back into the podcast to re-record this for you so that you can listen to it and understand some of the ways that we can cope with uncertainty within our clinical day. So if you haven't met me before, I'm Sarah Smith. I'm a family doctor. I work in practice and in the hospital system. And this is going to be recorded within the Sustainable Clinical Medicine podcast for you so that you can listen wherever you are in the world. So we wanted to look at where we have uncertainty within our practice, the effect of it, and how to cope with it. I first want to address magical thinking. Now, I'm not sure where this magical thinking came from, but most of us have it in some sort of way in their brain. Think about this. If I do everything right, I will get to the end of my career with no errors, no bad outcomes, no medical legal claims, no discomfort, no anxiety, 100% patient satisfaction, and 100% career satisfaction, as if it's all on us to do right, everything right. Now, it's magical thinking because it is not possible, is it? Because most of what we just experienced in that magical thinking was nothing to do with us. And external factors have everything to do with it. So, but just notice when we have these thoughts in our brain, that if I do everything right, then everything will go right. And we're going to explore why that's probably not true. So when do you experience uncertainty within your clinical day? Tell me some of the examples in your day. You can hit the chat. You can hop on in the podcast chat and tell us some of the examples of uncertainty within your day. But a lot of them came out of the diagnostic uncertainty, like, is this hypertonic tremor from medication or is it something else? Some of it can be from those questions of, is it appropriate to fill in this form for this patient? Is it appropriate to release that medication early? Should I take on this other question that just came up in the room? It was even as good as, I don't know when I'm going to have a pee break. I don't know what my patient's going to bring in today. I don't know who's going to ask me what on an email or a phone call, and it's creating a lot of dread or anxiety about our day. Literally everything about our day is outside of our control except you. So really, everything about your day is uncertain. Should I send this patient to the emergency department or follow them up closely? If we're going to be offered a new way of being paid, is it going to be okay? Did that specialist receive the referral letter I sent? What do I do with this result on a Friday night? Do I disturb the patient within their day? Or do I wait till Monday and now it's going to hang around over my head all weekend? But if I call them on it, they're going to now have a bad weekend. What do I do? Will my office manager be in a good mood? Should I stay in medicine? What else could I do if I decide this isn't the career that I wanted? Is that disgruntled patient going to report me? And now my whole career is up for possible ending. Like, these are some of the uncertainty that really grates at us, right? Even which imaging is right for this disease process. And if I call the radiologist, are they going to think this is a stupid question and everybody else in the world knows the answer except me? Okay. This is part of that uncertainty. It even went as far as, have I missed something? And that dreadful feeling and rumination over the course of the evening or night or weekend where you're not sure, did I miss something? Should I have known that? What else could I have done differently? Is this a safe world for my kids? Is the healthcare system going to create? Even these existential questions come up as part of the uncertainty that we're facing within our lives. So I like to talk about autopilot. Autopilot is our immediate reaction, our practiced reaction to some of these scenarios. And it costs us. So the way we automatically think about some of these things in our day gives us a cost. I'm going to give you an example. So I had a patient come into my day. He was a young man and he had some previous heart troubles and he was on his warfarin. And this was a long time ago. So I had a call the week before from the cardiology registrar to tell me, listen, you sent this patient into the hospital with chest pain and we did all of the heart tests and his heart is good. Do not send him back to the hospital for heart problems. It's not his heart. Okay. Sure. Noted. Thank you. Well, he came in and I could hear an audible knocking in his chest. Audible without a stethoscope, knocking in his chest. Clearly, something was going wrong. And I had certainty this time that it's not his heart, though that was going to go against my intuition that said, this is clearly a heart problem, right? What else causes knocking within a chest? So what did this uncertainty cost me? Well, I second guessed myself. I worried and I procrastinated about the decision-making process because I had had this experience the week before. Do not send him back to us. It is not his heart. Okay. What did I do? I sent him down the road to get an x-ray and with the instruction to come back. And when I got him back about an hour later, I took the film out of the bag. Yes, this was a long time ago. And I looked at the x-ray and confirmed my fear and suspicion that he had a lot of blood around his heart. And then I sent him down to the emergency department, confirming what I had been worried about. What had that cost me? Time, right? It had cost me and the patient a lot of time because of my uncertainty. Joy, peace, sleep, energy, satisfaction. These are some of the costs of uncertainty, right? Some of the costs that we're experiencing in our lives because of uncertainty. Here are some of the sentences that we have when we're faced with some of these scenarios within our day. I should know this. No one else could know this without any certainty, right? If I say yes to this, will it create ongoing problems for me within my clinical day? Is this a legitimate reason for filling in this form for this patient? Would my colleague know this? What do I do with this? I don't know. Why do I find this such a challenge? What if I work all these years and it's not enough? What if I made the wrong decision? I guess I have to, or they'll put in a complaint. What if they yell at me because it's a stupid question? What if it's easy and I'm an idiot? What could I say that would be reasonable? When we look at the literature around uncertainty within medical decision making, here's what we know. The tolerance, how tolerant we are of uncertainty, will impact our test ordering behavior. If you're super worried that you're going to miss something, you'll order everything, right? Or if you're not too bothered by this uncertainty about what this could be, then you'll likely just say, let's see if it goes away, right? So that's that tolerance of the uncertainty will create an effect on your clinical decision behavior in the room. Medico-legal worries are implicated as one of the reasons for increasing use of tests within family practice and probably within other specialties too. Uncertainty is a powerful source of stress for patients, right? Well, I still have this pain. Even after all those tests, you still can't tell me what it is, right? We all have those. Or what do you mean you can't tell me how long I have or how bad this will get? Right? That could be anxiety provoking for our patients. And it's certainly linked to burnout for physicians and clinicians. This uncertainty and the worry and rumination and anxiety that it creates. So think of your autopilot like an unsupervised toddler, right? If you haven't taught your toddler what to do with paint and where to put the paint, guess where they put the paint? Anywhere they want, right? They make up the rules. So this is what our autopilot is. But the good news is that we can rewire our autopilot. So the self-coaching model is part of what we learned as becoming coaches, but it's also part of CBD, right? The CBT training of cognitive behavioral therapy for yourself. So we have the facts of what the patient asked us to do or what's happening within the day that's creating a story or drama that is having that underlying theme of uncertainty. This drives a feeling. The feeling could be dread, anxiety, fear, confusion, shame, disheartened, excited. Some people get excited by uncertainty in diagnostic dilemmas. What? Yes. All of the feelings that come out of some of these scenarios are based on the thoughts we're telling ourselves about what's happening. Each of these feelings will drive an action. And if we're within those feelings of dread or anxiety or fear, then, or confusion, we would have an action like indecision, rumination, decision delay. And each of these actions will produce a result, which is just new information. So when we're thinking about how do we change our autopilot, here's the good news. We are not our life. We are not our brain, because we can actually sit back and observe our brain thinking. We can observe us doing our life. We create our feelings with the stories that we're telling ourselves about the world and other things. We create our results with the actions that we're taking. We can never control other people, and we're never in control of other people's feelings or actions, because it's their brain deciding what to do with facts or information and how they're feeling and how they're working through that with their actions. So the first step is noticing that you are a licensed physician or clinician. And that means that you have authority in this space to see patients and make decisions. You are already worthy to see patients. You are already capable. You are amazing. You always arrive at work with good intentions to do your best for patients and keep it professional. And you are an expert, okay? This is our foundation. Do not ever find yourself under the foundation, digging around in the mud, thinking that you're unworthy. You have a solid foundation under you, and it is that certificate that says, I am a family doctor, nurse practitioner, cardiologist, whatever it is, you are already 100% worthy, capable, amazing, right? And you always have that understanding about yourself that you are there with your best intentions to do your very best for patients. And then there's everything else that you cannot control. The world outside you, the practice you work in right now. I mean, you can have some influence over it, but this is your current situation, okay? There are other people, you can't control them. Even if you go and change your circumstance, so you pack up from this location and go work in that location, you're still going to face uncertainty, okay? So just changing your world doesn't change you and how you show up when you're seeing patients, or how you deal with uncertainty doesn't just change because you change location. It has to come from the inside. Step 2 is the thoughts or drama or story or sentences that we tell ourselves about those things in the world. These are just sentences, and all the sentences are available to us. They're all optional. No one can steal the sentences out of your head. You can observe what your brain's thinking about, and your beliefs are well-practiced sentences. So a belief could look like, I'm no good with rashes. That's not a truth. That's a belief about you and the rashes that you see in your practice. If you wanted to, you could decide, I am going to become an expert in rashes. That is another sentence available to you. So we can decide our thoughts on purpose. How do we observe our brain thinking? We can ask it questions like, I noticed that I have a thought that says every year medicine is getting more and more complicated. Okay, that's a way of observing what we're thinking. My brain offers me the thought, I don't know how much longer I can keep doing this. Okay, I wonder why I think I have no control, that they could destroy everything I've worked so hard for with one decision. Okay, so these are how we observe those conversations, that autopilot that our brain is having towards some of the things within our clinical day. Feelings. So each of these sentences that we have will create a feeling. Think about your in basket. Okay, all those things that are plopping into your in basket all day long. A common sentence is, I hate my in basket. There's so much in here. I don't know what to do with it. It takes so long. I hate my in basket. Okay. Common? Yeah, we could probably mostly identify with that. So you might think that I hate my in basket, has a feeling in your body. What is your feeling when you think I hate my in basket? All right, it's 6 p.m. on a Friday night. You've decided to stay back to do a little bit more in the in-basket. How are you feeling when you think that thought? Dread, right? It's not, oh, excited. It's dread. I'm dreading doing that. Or you're dragging your feet. You can feel this sitting in your body. I'd call this a negative feeling. So the fun thing about the humans is we love pleasure, we hate pain, and we love to do things efficiently. So this practice thought, I hate my in-basket, is how we approach the in-basket. And we also do things efficiently. So we were looking for pleasure, we hate pain, and we do things efficiently. So if you're looking for pleasure and you think the in-basket is painful and you do things efficiently, it might look like picking up your phone and looking through Facebook when it's time to do your in-basket. And you're like, why do I do this? It's because your brain is looking for pleasure, and that's what you always do. Facebook is your place to go when you're feeling this anxiety and dread about your in-basket. We call this false pleasure because it's creating a net negative. It's creating escape from your current dread about the in-basket, but it's not creating the in-basket getting done. So it's a net negative. It's an escape. It's creating this false pleasure. And then we do this fun thing called adding suffering. What does that look like? I'm so useless. I've sat here for an hour and got 2 results done, right? That then just slaps us around. We're just being mean to ourselves. The other fun thing about feelings is sometimes we experience negative feelings on purpose to get a new result. What does that look like? Okay, I'm going to feel hungry rather than overeating another donut so I can achieve that goal for my health, whatever that looks like for you, right? So discomfort, you could choose, I want to feel uncomfortable so that we can get a new result. I want to feel dread about my in-basket and sit here in dread, but click off things out of this in-basket so that the in-basket gets done rather than escaping into my phone. And that then becomes a positive because you're deciding to experience the dread with the intention of creating this new result for yourself. It's a little bit trippy, but just watch those feelings through the day because our feelings drive actions. So remember, we had that example of that human in the room with his knocking chest, right? And that feeling of, for me, anxiety because of the thought, I'm told it's not his heart. I'm not allowed to send him back to the hospital for something related to his heart. I'm feeling anxious. It drove an action, didn't it, of me sending him down the road for an x-ray instead of to the hospital. Okay. So those feelings will drive our actions, or those sentences will drive a feeling that creates an action plan, and it's usually done with the way we've done it always. It's just we can start to be curious about what it's creating. So the current results we have are related to our autopilot, how we show up. So when you're dreading clinic tomorrow because I don't know what the patients will bring in, I don't know what I'm going to see, I don't know if what they told reception is actually what they're going to come in with, that's so complicated, I don't know if I can do it, I'm not sure I'm set up correctly for seeing anything that could walk in the room, that's creating, I don't know if I can do it as a result, right? So it's perpetuating, it's finding evidence for how I don't know if I can do it, or this is hard, or my clinical day is complicated. So if you've got this result that you're always dreading work because you've got this constant thought, I don't know if I can do it, I don't know if I can do it, I don't know if I can do it, creating dread, creating actions of, I don't want to go in, we're procrastinating, we're getting there late because we're dreading it. That is just because of the way we're currently thinking about it. So if we start to be curious about what we're thinking and find new ways of thinking, that would create a different result. I don't have to make everything right. I can look for the next best step for all of my patients. I can help my patients even when we won't know necessarily what's going on. It creates a different feeling in our body, like, I think I can handle it. Most of the time, I can handle what I experience in the room. Most of the things that come in are things I've seen before. Creates a different feeling in our body. These thoughts create a different way of anticipating the clinical day. Just as an example. So let's go through some of these current thinking and some alternative ideas on what else is possible. So we're going to have a patient scenario. It's all theoretical. Mrs. Jones reports fatigue, weight loss, and a widespread rash. And despite your best efforts, there's nothing else on history or exam. That's it. That's all you got. What would you think? What would you be thinking about if you were in the room with this patient? How would you be feeling if you had this come in? What would you be doing? And what would you be having as your current result? So let's dive in to physician number 1. Physician number 1 is in the room with Mrs. Jones and starts in their head to think, I don't know what's going on. I don't know where I should even start. I just don't know enough. Physician one is feeling disheartened, right? That's not a nice place to be when you're listening to a story about a patient. What's the action? Indecision, hesitation, rumination, self-criticism. You might start looking up common fatigue and rash differentials. You might order a bunch of labs and tests so you look busy, but you're just not sure that you're trusting yourself to know about what's going on. You'll often leave the charting till later in this scenario because you don't have a working diagnosis. So why would you close this chart, right? You'll plan to look things up and you might meekly admit to the patient, I just don't know what's going on, or something similar to that, okay? It doesn't sound like certainty for sure. What is the result? We're creating the result of confused and disheartened, and it creates evidence that, see, I just don't know enough. All right. So that was that original autopilot thought. I don't know what's going on. I don't know where I should start. I just don't know enough. So what else was possible about this scenario? Let's go to position number 2, or another possible out of the infinite possibilities. All of the sentences are available to you. All of the sentences are optional. We can choose to think, I just don't know enough, or you could consider this idea. So the fact stays the same. We still have Mrs. Jones, fatigue, weight loss, and rash. Nothing else on history or exam. Okay, nothing changed about the scenario. What's going to happen in this consultation room? So this story or sentence says, I don't have a working diagnosis. I can find the next steps to get some more information. I can help her. What does this feel like? This feels purposeful, right? Can you feel that purposeful feeling that would come out of those words? What would that drive in terms of action in the room? Well, it could look like stepping into curiosity about which tests may be of most benefit to determine the diagnosis. It would provide advice that this is important to the patient, including the diagnostic dilemma, and clear communication about the red flags to return for reassessment, right? So you say something like, listen, you're complicated. We're not going to know what's going on today. I need to get some more information. But here's what I want you to know is if you start having bleeding or high fever, I'm going to need to see you back faster, or I need you to go to the hospital. Okay. So this is coming from a different place. This is a way of thinking where I can help her even if I don't know what's going on. What is the result created? Is you are helping even when the diagnosis is uncertain. Was there anything different done clinically in these rooms? No. Both of these physicians did something to help the patient. But one is coming out of disheartened, I don't know enough, I'm not good enough. The other one's coming out of, I don't know what's going on, but I can find the next step and I can help. Okay. So it's not about the actual medicine. It's about how that would feel going through your day. It's going to feel a lot more light if we're feeling purposeful rather than unworthy, not knowing enough, not good enough. Okay. In this next one, it's less about the clinical medicine. We're proposing a new payment model for family doctors. Okay. This happens from time to time. It's a reasonably normal phenomenon around the place. So what are some of the ways that we could autopilot this? The story. That's so typical. They don't know what we need. They're making it impossible to earn an adequate income. I don't have financial security. Okay, that could be an autopilot response to the world. What would that feel like? That would feel like fear, right? I don't have financial security feels like fear. What does fear do in this scenario? You might ruminate about the cost of running a practice. You might talk with colleagues about what the new payment models might look like, hypothesis, theories, throwing it around. You might vent on Facebook or to your significant other. You're still fuming or ruminating as you go to bed, and you're getting more and more exhausted. What does that look like? Well, that could look like reduced efficiency within your day because you're so worried about what's going to happen in financial security. When the electricity bill comes in for the clinic, you might say, why is this $20 higher than last month? And it doesn't come from a place of curiosity. It comes from a place of fear. And who do I have to yell at? Who left the lights on that created this higher bill? Okay. It's coming out of that fear of financial security. I don't have financial security. Okay. So we're creating that I don't have enough again. What's an alternative? Well, the fact doesn't change. We're proposing a new payment model for family practice, and that's all you get. That's all the information. Your story. That's so typical, right? Same initial autopilot. Your autopilot will still show up. Okay, that's so typical. They don't give us clear information ahead of time. Just notice that. Even if you're looking to create a new response, your autopilot will still show up. We just get to notice our brain having that autopilot experience and then intentionally saying, and what else? What else is possible here? How else could I start to approach this? It doesn't feel so awful right now. What else could I be starting to be curious about? So in this situation, that's so typical. They don't give us clear information about changes ahead of time. I want financial security. What does that sentence feel like? I want financial security. It feels determined, okay? When you're determined to create financial security for yourself, you might start actively looking for ways to improve financial security. When that electricity bill comes in and it's higher, you might start to have a team meeting to say, how can we start to reduce our electricity bill? Who's got some ideas? Okay. This is you saying and finding evidence for, I create my financial security. Same fact in the world, same autopilot response, but a completely different experience that you're having about it. Okay, so let's move back into the clinical situation. We now have an example of a 5-year-old with asthma and some borderline oxygen saturations, and you're seeing them in clinic. In room number 1, we have the story. Should I send them to the Emerge, or should I watch them closely, like close follow-up? What if I make the wrong decision? What does that sentence create? How do you feel when you think, what if I make the wrong decision? It feels heavy, doesn't it? It feels overwhelming that somehow, if I get this wrong, okay, it feels important, but it also fills us with self-doubt. What if I make the wrong decision? What does that feeling of self-doubt create? So it creates some indecision in the room. It creates rumination. You're thinking, spinning around in these thoughts. Should I, shouldn't I? Should I, shouldn't I? It procrastinates the decision making. You spin through those pros and cons. You feel stuck. You choose an option because eventually you've got to get them out of the room, right? Eventually we've got to move on to the next patient who's waiting. So we choose an option, but then what do? We keep doubting, we keep worrying that we made the wrong decision. Sometimes you'll check in with the parent or a colleague. What should I do? Or what do you think we should do? Right? That comes out of this, I doubt myself and overwhelm, not saying you can't ask for help, but it's coming from a different place. It's coming from a place of I don't trust myself. I need to look for help. It's coming from a different place than I need more information. I need to go and seek other people's opinion, that co-decision making. But when it's coming from self-doubt, it's coming from I'm not good enough. I need somebody else. And the result is you're not trusting yourself to make good decisions. Okay. That feels heavy and hard as you're going through your clinical day. All right. So then what's happening in the alternative idea? So remember, all of the stories and thoughts we have about the way we practice and the way our patients are presenting and the scenarios that we're facing, the automated pilot is, I don't know if I'm going to make the right decision. So that still comes up. Okay, that doesn't just go away because we start to do things differently, but we start to step into looking over our shoulder, looking over our own shoulder about how we work, how we're working within our clinical day. We observe these responses, and then we can start to be curious about what else is true, what else is available to me. How do other people handle this type of uncertainty? So let's look at one of those infinite possibilities for the story or thought we could have with the same fact. So we have a 5-year-old with asthma and borderline oxygen sats in clinic. Here's another option for the story or the thought. This is worrisome. I could send them to the emerge, or I could send them home with instruction and close follow-up. I know that either option right now is appropriate. I can work through this puzzle. So when we have this idea, this story, this thought, I can work through this puzzle. It creates a feeling of curiosity, right? That could be one of the feelings that we would experience with that thought. What does curiosity drive in the actions? It does this. You exhale. Oh, you choose curiosity. Then you start to be curious. What information would help guide me in deciding between sending home or sending to the emerge, right? You're going to gather some data that helps you sway the options. You'll discuss the options and make a decision with clear instructions to the parent. Now, discussing that probability with the patient or the parent is, in the literature, a good strategy for uncertainty. Okay, it could look like this. Right now, your child could go to the emergency department, or we could send them home. There's a possibility that this asthma is going to get worse tonight if we send you home, and you'll need to go to the emergency department later. You could say high, low, middle, but there's a possibility, right? And so here's what you need to watch for that would tell you that you need to go to the emergency department. And we educate with clear instructions. You remind yourself there's no clear right answer right now. It's just the best judgment in this moment with the information you have, the clinical presentation, their social environment, the other family dynamics. Like, we've got so many pieces that we're considering in these complex medical decision making. That's part of the uncertainty. All right. And what does this scenario create for you? So you remember your original thought was, I can work through this puzzle, and the result you create is, I trust myself to make good decisions. That feels different. It feels less overwhelming than I don't know if I'm going to get it right. And I don't know if I can trust myself to make good decisions. Okay. It's going to feel different in your clinical day with this different option for how we could think about this presentation. Okay. Now, the following morning, you're back at clinic, you open that in basket, and you notice in your in basket a notice of admission for that 5-year-old that you saw yesterday with the asthma. Uh-oh. Right? Oof. It may not be the kid with asthma, but you've had one of these. Oof, they're in hospital, right? What is the story or thought that you have in that moment, that autopilot? It could sound like this. I should have sent them to the emerge. What if he died last night? My judgment is clearly impaired. I can't trust myself, right? We've all had these moments. I want to encourage you when you have one of these moments, and this one may not feel like a big deal to you, but listen, there will be a big deal in your history in medicine. There will be a big deal probably this week or within a short time frame. Why? Because you cannot control patient outcomes. There is no way you could control whether this child's asthma was going to get better or worse, right? It is not within your capacity. You are not that super, you don't have those meta skills to make sure your patients are okay. So this is a common scenario, and I want to remind you, do not do this alone. Have a friend or a colleague that you talk to when these scenarios come up, and they come up on the regular. You will have these questions of, my judgment is impaired. Can I trust myself? Did I do the right thing? Am I making right choices? Am I making wrong decisions? Talk it out with a colleague. You will hear, oh yeah, that happens to me too. Oh yeah, that happened to me last week. Oh yeah, that happens. And this is how I managed it. I want to remind you to go back to that work we did at the beginning that says, separate the what's happening with who you are. What does that look like? I am a practicing physician clinician. I am worthy, 100% worthy to see patients. I am amazing. I always show up with the intention to do my very best, and I never have the intention to harm patients. Okay, remember that is our rock solid. Do not go under there and go digging in the dirt. You have a solid foundation that you are worthy. You are 100% worthy of being here in this space as a practicing physician clinician with that license that says you are. Okay. Then from that place, and it might take a few conversations with a colleague to feel like you're worthy. Do that. It's so important to you. Please do. Please pause and go and get that conversation connection from others. And then anything, good or bad, that happens to our patients, their story, their presentation, the decisions you made, the decisions the team made, the outcome, you can now problem solve that. You can look through it and decide, if this happened again, if this same kid came in with these same symptoms, would I do the same thing? That is part of our job as a practicing physician or clinician. That review of what happened, would we do it again differently? What went well with this? Was that decision correct? How would I like to do this again? That's your problem-solving brain. These are your high-level skills. Use them. But don't come at it from a place of, I suck. What should I be doing differently? Come at it from, I have the training I need. I am worthy to see the patients. I always have the patient's best interest at heart, and I can learn. I can go and do upskilling. I can review what happened from an objective place of, is that how I would handle it in the future? Okay. There's a big difference in how you would come at this problem from both of those lenses, right? Just notice that as things happen in your day, they may not be big things. They might just be little ones that, right? Just that being able to look over our shoulder and say, hey, I noticed that. You're not trusting yourself can be so powerful for you to uncouple you from these, I make bad decisions. So let's go back. So we've got this notice of admission in the in basket. Uh-oh, I should have sent them to the emerge instead of close follow-up. What if he died last night? My judgment is impaired. I can't trust myself. How does that feel? Self-doubt, anxious. Ugh, right? It's not a fun feeling, is it? It's a pit of your stomach feeling. It's a I did bad, right? It is not the fun part. Okay, what is your action from this place? Well, you spend 10 minutes trying to find that admission story. What were they like when they presented to emerge? What was happening? Okay. That's a delay of our first appointment, maybe, as we bounce the case off a colleague to verify that we clearly, truly suck, right? This is, a kid went to hospital yesterday. I saw them in clinic. I should have sent them to the emerge. And we're expecting our colleague to say, yeah, you suck, right? What actually happens when we do that? They're like, oh, you know what? Anyway, I defer. You clearly are expecting them to say, oh, yeah, I would have certainly sent the child to the emerge. The new guidelines would have told you that too, right? This is what is going on in your head. This is how you evaluate what happened, is you're coming from that place of anxious and self-doubt and I can't be trusted. These are the stories you'll make up in your head. You might eat the donuts that the drug rep brings. You bounce every decision, every clinical decision off your colleague for the rest of the day or all week because you can't be trusted. And you ruminate about this child and their presentation all day and tonight and for days. What is the result you're creating other than an ulcer? It is that you are not trusting yourself to make good decisions. Okay. How does that feel as you're going through your day thinking these stories about yourself? It's not nice, is it? Right? Self-doubt, anxiety is not an easy way to do medicine. That is a really heavy way to do clinic. All right. Now what? Well, that's clearly the right way to do it. Is that what your brain's saying? But clearly I made a wrong decision, and that's true. The thing about our autopilot is it feels true. It feels like that is exactly how I'm supposed to approach this. Interesting. Is that what every physician or clinician in the world would do? What else is available to us? Well, let's check it out. So, same scenario. You saw this kid in clinic yesterday and you're in the in-basket the next morning and you see a notice of admission to hospital. Your story or thought, that was a possibility when I saw them, right? It was a possibility that it would get worse. I'm glad they followed my directions and went to the emerge. This is worrisome, but I determined that in the moment when I was seeing them, they did not need the ER. It wasn't necessary at that moment. I can trust my decisions. Notice the difference. You're not saying, oh, it's fine. You're saying, oof, this was a possibility. It's worrisome. But when I was seeing them, it was not a have to the emerge. I can trust my decisions. What does that feel like? That feels like self-confidence, not arrogance. A self-confidence is I choose not to beat myself up for my past decisions. I choose to decide that I can honor myself in my past decisions. And remember, you get to decide that if I was to see this again, I would do it differently. And that is from a place now in self-confidence of that true reflection of what were the facts and what would I choose differently, coming from a different place than I suck. Is coming from a place of, okay, well, I made the decision I made in the moment, and I'm choosing to honor that. And I can also look through that scenario and decide if I would do anything different. Okay. So this self-confidence feeling, what would that look like in action? So you would deep breath, exhale. You would deliberately choose to honor your past decision, right? When I saw them, it was not necessary that they went to the emerge that moment. Gently remind yourself that you did explain to the parent what to watch for that would prompt an emergency department visit. Purposely start on time, looking after your current self, and practice your calming exercises. I'm not saying that it feels amazing that the kid you saw in clinic yesterday is now in the hospital. I'm saying it's coming from a place of love towards you, your past self who was seeing the kid in clinic yesterday, the you who is now reflecting on that activity from yesterday, and then looking after yourself through today. You are absolutely, you could still totally go down the corridor and chat to a colleague about it, but you're more mindful. Is this the time to do this? Is it urgent that I do this? Or can I pause for a moment, get on with my day, and find a time to sit down with a colleague and just go through this, because I want to know that this is how I would have approached it if I was to see this again. And what is the result that this creates is, oh, I can trust myself to make good decisions and determine that I will honor past decisions that I have made. Okay. You don't have to be your own bully, which is very nice. So remember, you are not your life. You can actually sit and look at your life. You are not your brain. You can watch your brain working. You can watch it autopilot. You create the feelings that you're experiencing within the day, for good or for bad. And you're creating your results in the actions that you're taking. You can't ever control other people, and you're not in control of other people's feelings or actions. So overcoming our autopilot. So the good news about medicine is there's no right answer in complex medical decision making. So, when you think, I don't want to get it wrong, well, guess what? There are at least 3 answers or options for most of the clinical scenarios that we see. So you're not looking for the right answer. You're looking for the next step, the next idea for this patient. There's always another test or more information or a different perspective. So when you're reflecting on what you did, there was at least another 3 opinions on how you could have done it. So that's why looking for right is going to spin you around in overwhelm every single time. We know that collaborative decision-making is used in medicine. Think of those oncology grand rounds or surgical grand rounds where we're talking about patients and trying to decide the best next path for them. It's supposed to give us alternative perspectives and new ideas. So when you're asking your colleagues what they would have done, they're probably not going to do what you did. And it's not because you're wrong. It's because they're giving it to you from a different perspective or from different things or things that they've seen or other things that they've learned. Everybody's got different ideas and information that it is affecting their decision-making. A good doctor-patient relationship is vital. It creates trust with understanding what is important to the patient and helping them deal with uncertainty, okay? So that's part of what the evidence is saying around uncertainty. Evidence-based medicine should be used when available, and discussion of probabilities where appropriate is in the literature as part of the ideas for coping with uncertainty. You should be aware of how you solve puzzles, because this is helpful when you're role modeling for your learners. Okay, they're like, how did you come up with that for this patient? And you're like, well, I thought about their other complex diseases and who they live with and how much money comes into their house, how likely they are to take this versus that. That's what helped me guide this decision. And they're like blown away with what you just did in your head around this complex medical decision making. Okay, so this is dealing with uncertainty and making a decision is a super skill that you manage throughout the day, multiple times a day. Looks like a superpower when it comes to your learners. They're like, whoa. Expression of feelings by learners should be encouraged, acknowledged by preceptors as a useful tool for dealing with uncertainty. All right. So, in summary, watch your automated responses with curiosity. Don't suddenly decide that all of your thoughts are wrong. Just watch for them. Remind yourself you always have a choice. Okay? What you think, there's always another side of the story. What else is possible? What else is true? How are you feeling and why? All of the thoughts are available to you. We don't have to have this soundtrack in our head that we suck, we make wrong decisions. That is optional. Yay. Self-doubt and self-confidence are a choice. It might be really hard to step into self-confidence if you've been in self-doubt for such a long time. So just be gentle with yourself. But you could choose today to stop beating up your past self. Okay, that would be amazing. That would step you closer to who you want to become. What do you want to create? Okay, that would be fun. So there are some references that were helpful. You can just do a literature search on medical uncertainty in medical decision-making in medicine and dealing with uncertainty in general practice. You'll find some of those articles. And the Life Coach School podcast is one of the mentors that I have that goes through this thought modeling really well. So if you listen to episode 1, 22 was on self-doubt, and 58 was on self-confidence. There are other places that you could go to hear more fleshing out of these. What is the alternatives that are available to me when it comes to coping with uncertainty in life or in that clinical decision making? If you are here and you are a resident, I want to remind you that we have a program called the Smarter Charting Program, which is there to help you as you navigate these changing workplaces, changing workflow or amount of work that you're doing, the different preceptors you're working for, and their different expectations, patient expectations. Smarter Charting Program is our program that's been running for clinicians, and now we're accepting residents into that as well, because a lot of what you're working through in those years as a resident, we understand as preceptors the types of things that you are dealing with, and we would love to be able to help you. For those of you who are working on that in-basket that you are not loving, that you are hating, the in-basket, remember to check out backlogbuddies.com, which is a co-working virtual platform where you can do backlog alongside other physicians and clinicians. Thank you so much for the opportunity to have walked you through this. This is not the be-all and end-all of teaching on uncertainty, but it's just the start of a conversation to help you navigate uncertainty within your clinical day. Thanks, everyone. Have a wonderful week, and I'll see you next time. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca There you'll find all the information on the Premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.